Assalamu alaikum wa rahmatullahi wa barakatuh. I'm Osama from year 2 and I'll be explaining today viral hepatitis, inshallah. Stay tuned. So we can start by classifying basically the different types of viruses by their means of transmission. But before doing so, we can quickly point out that only the hepatitis B virus is going to be from the DNA family. Otherwise, all the others are from RNA. This can be helpful later when studying the pharmacology because it can help you understand how how its treatment is going to differ from the rest, because we're going to be targeting the DNA rather than the RNA. So we can subclassify these viruses based on their means of transmission. So we can group together hepatitis A and E, both being spread by the fecal-oral route. So that can involve anything from touching contaminated food to feces, water, and so on and so forth. It's worth mentioning that hepatitis A, again, is going to be acute. So remember AA, as well as asymptomatic in children. And it's usually going to be self-limited and short. So it is very minimal and will not progress to chronicity. That is very important to highlight. Whereas on the other hand, hepatitis E virus, you can point out, again, the fact that it says expectant, meaning it is only going to appear in pregnant women, or mostly in pregnant women. So if a case comes to you and mentions a pregnant woman with viral infection and the symptoms, then you can always expect hepatitis E. On the other hand, if they mentioned self-limiting minor, again, or mild form of the disease, then we can go to hepatitis A. On the other hand, hepatitis B, C, and D are going to be linked to what parenteral route of transmission. So that can range from anything including your sexual contact. That could be blood transfusions, very common in patients with blood transfusions. You can see in cases involving hepatitis B, C, and D. Those suffering from thalassemia, for example, frequent injections, so transfusions. Birthing, so it could be passed from mother to offspring. Actually, a common infected personnel is going to be those in the healthcare, because again, what of the needle prick injuries. So hepatitis B, generally speaking, again, also has a long incubation period, as we can see. It can progress to a chronic hepatitis. However, usually is going to be acute and will resolve. But again, obviously, complications can occur, like we said, can progress to carcinomas. However, usually the most common cause of cirrhosis or carcinoma is going to be hepatitis C. Again, means of transmission, we mentioned, same idea, long incubation, but it's going to be associated with hepatocellular carcinoma, very, very common, as well as what, liver cirrhosis, and it's going to be, again, C, hepatitis C, therefore most common form of chronicity. Hepatitis D, very simply, what you need to understand is that you cannot ever acquire hepatitis D without hepatitis B. It is going to be either superimposed, so together you get it as a co-infection, or it will be superimposed over hepatitis B. So now, how can we tell that we have each of the following viruses? Usually there are certain markers that can help us identify such occurrences. So for instance, with hepatitis A, there will be what we call the hepatitis A virus IgM antibodies that indicate an active infection. And usually if we have the HAV or hepatitis A virus IgG, it is protective, meaning either we've had a past infection and now it's been resolved, or we have been immunized against hepatitis A. So again, keep in mind, hepatitis A, in repetition, again, in pregnant women, fulminant hepatitis. Hepatitis B, as we've mentioned, we'll talk about the markers in a second. It requires more in-depth explanation. But generally speaking, acute hepatitis and can sometimes progress to chronic. Hepatitis C, again, you can do a HCV, again, hepatitis C virus RNA test to confirm its presence. And finally, again, D in repetition is going to always be dependent on hepatitis B. So now on to the markers of the HBV. The general structure antigens, it's important to understand. We have what we call the HBS. That is going to be the surface coating protein, the outer. We're going to have the HBC, which is going to be your inner core protein. That is usually not detectable, but antibodies against it will be, as we'll see. And you have the HBE, which is going to be what's called secreted protein. It says the function is unknown, but generally we take it to indicate active replication if it's present, whereas antibodies against it indicate that there's no more replication. So we'll see in the next slide. So now on to the hepatitis B serology. This is very important to understand for interpretations of the hepatitis B panel. We can tell here again that HBs antigen, always when present, is going to indicate that we have a current infection. Now, whether or not it is acute or chronic, we'll see. It will have to occur with other things. And by the way, even the HBs antigen is going to be used to extract vaccine for against hepatitis B. So we use this from yeast to build an RNA vaccine. If we have HBs antibodies, what could that tell us? Again, either that you have recovered, you've had a past infection, or you've been immunized. Like we said, we administered these HBs engineered vaccines, and then they produce antibodies for us. Anti-HBC IgM, again, IgMOs as we know, indicates acute infection. So therefore, if you have IgM anti-HBC with your HBs antigen, what does that mean? You have a current acute infection. On the other hand, an IgG, again, with HBs can indicate a chronic infection, or if it's alone without the HBs, it would indicate a past. So again, we'll see in a second. HBe, as we've mentioned, can indicate active replication. An anti-HBe, it's no longer replicating. So it's important to take a minute and go through this list before going on to the next, which is the panel interpretation. So now on to the interpretation of the hepatitis B panel. As we can see, we can go through the list. Let's start with the first one. It says that the person does not have HBs antigen, nor the anti-HBC, nor anti-HBs. So what could that tell us? It means that the person has not yet been infected with hepatitis, and therefore that makes them susceptible. So they've neither been vaccinated nor have they been infected. Moving on, we can see here that the person does not have the HBs antigen, but they do have the IgG. Again, we said that indicates a chronic infection or a past infection, and they have the anti-HBs antibodies, but no HBs, therefore indicate what? An immunity due to natural infection, meaning the person has been infected. Again, what said that this is not vaccination, what tipped us off? The fact that he has anti-HBC IgG antibodies. Now here we can see that he neither has HBs antigens nor the anti-HBC, but they do have the anti-HBs. So what does that tell us? That this person has not been infected but has been vaccinated. So again, due to vaccination. And now moving on, we said the person currently has an HBs antigen, all right, and it says that they do not have anti-HBs. That means they have not been cured yet, all right, but they do have positive IgM antibodies, all right. So what does that tell you? IgM, again, an acute infection. Finally, we see that they also have HBs, all right, that indicates a current infection. They don't have IgM anti-HBCs, meaning again that is not acute. They don't have anti-HBs, meaning they have not been treated, but they do have the IgGs, therefore indicating that they currently are chronically infected.